Welcome back, guys. If you've seen my popular sertraline review video, then you know that I never intended to stay on medication for long. In that video, I share my personal experience with Zoloft or sertraline and how it affected my life in the first year of taking it. Now we're on year 2 and it's been filled with some surprising side effects. And the main side effect that I'm going to talk about today is irregular periods. Now, I had no idea that SSRIs, particularly Zoloft or sertraline, what I'm prescribed, can cause bleeding between periods. My doctor never mentioned that to me, and if he had, it probably would have changed my perspective on taking it. I have a history of uterine fibroids, excessive bleeding, bleeding between periods, irregular periods. That almost took my life at one point. So here's the story. About 4 months ago, I started spotting and bleeding between my periods out of the blue. I didn't know what was going on, but I brushed it off. Then over time, I realized that my period was just erratic. I didn't know if it was coming or going, no regularity at all. And now I started to become anxious about my reproductive health and what's going on with my body. Naturally, I made an appointment with my OBGYN. I couldn't get into her for, it had to be about 3 weeks. It took me to get an appointment with her. I was fearing the worst, anxious the entire time, Googling. I thought it might be cervical cancer, so I'm anxious and still taking the sertraline because of it. Had my doctor's appointment, had a pap smear, all the tests came back clear, everything was fine, but I'm still spotting. Ironically, at the time of my appointment, I'm not spotting. So you know how that goes. You have some issue going on, and then as soon as you make an appointment to see the doctor, it disappears for that moment in time. That's what happened to me. So my doctor wasn't able to see actually what I was experiencing because it wasn't happening at the time of the appointment. But she did tell me to go ahead and keep a log for the next month or two of what was happening, of the spotting, of the bleeding between periods. And at our follow-up appointment, we would see what the next steps were that we were going to take. So lo and behold, I stopped taking sertraline for the next 2 months that she had me monitoring the bleeding. So keep in mind, I'm not super regular with my meds anyway. I kind of only use them when I'm feeling some type of way, anxious, panicky, and then I'll just take them for a week or two, and then I might stop for a week or two. That is not the way that you're supposed to take your medication, but that's the way that I take it because I don't really feel that comfortable being on medication. So 2 months go by, I haven't been taking sertraline, and the spotting stops. It has stopped. Then something in my life happened. Honestly, I can't even remember what happened, but something in my life happened where I was feeling anxious and I decided to start taking sertraline again. Just like clockwork, I start bleeding again between my period and spotting. This is when I start to connect the dots. I do a Google search again, and I find out about amenorrhea. I believe I'm pronouncing that correctly, which is when a menstruating woman does not have her period. She misses her period for months or two. Now, that was not what I was experiencing, but I did find out that certain SSRIs, including Zoloft or its generic form sertraline, can cause amenorrhea. Again, was not informed about this side effect when I was prescribed sertraline. Evidence suggests that taking SSRIs like Zoloft may lead to a heightened risk of vaginal bleeding or spotting between periods by limiting the amount of blood serotonin taken up by platelets. SSRIs impede serotonin synthesis in these cells. As a result, since serotonin is vital in promoting platelet aggregation and less serotonin is present within the cells, there can be a heightened risk of abnormal bleeding. So I've been off my meds for about 7 days now, hoping to restore my menstrual cycle to normal. And according to what I read, it should be back to normal within 3 months or so. So moving forward, how am I planning to manage my anxiety journey? I will be turning to my trusted CalmyGo device. If you didn't know, you should know. CalmyGo is a guided breathing device that is scientifically proven to reduce feelings of stress, anxiety, and panic in less than 3 minutes. So guys, this device is very effective. A couple months back, I had a panic attack that actually caused me to lose my voice momentarily. I could not even speak. I grabbed this device out of my bag, inhaled until I saw these lines turn blue, and I was able to regain my ability to speak and within moments. So this is a trusted device, and this is what I'll be using to maintain my anxiety going forward. By the way, for all of our loyal Jute and Olive community members, you can save $30 on the CalmyGo site-wide using the code JUTE30, JUTE 30. Guys, like, comment, and subscribe. Turn on the notifications, and I'll take you along with me on this journey. At Jute and Olive, we believe that you should never have to choose your health over your sanity. And that's the reason why I make these videos about alternative solutions to medication, and also not bashing medication, but having alternative solutions as well. I had such a great time chatting with you today, so why don't you stick around and watch my next video, and I'll see you over there.